No, I do not have breast cancer. I am what is called a previvor, which means I have a predisposition for hereditary breast and ovarian cancer. I am BRCA2 positive. My mother's side of the family has quite a bit of breast cancer involvement. My mother was diagnosed at 42 and passed away at 52 of breast cancer and metastasis to her bone and liver. Her sister had breast cancer, eventually died of ovarian cancer, and her brother had breast cancer, but he is still living. I had a fear of breast cancer ever since I was 26 when my mother passed away. I had had mammograms every year since then, and just expected to get cancer at some point. I just figured it must be hereditary. So I got my testing done and found out that I was positive, and got my options and discussed with the doctor what things that I could do, if I wanted to do high-risk screening or if I wanted to have surgeries. When I was told I have an 82% chance of developing breast cancer, I wanted them off. I wanted my breasts removed. I had waited a long time to have that finality to make that decision, and I had no hesitation to do it. So I decided that I would have a prophylactic double mastectomy, and I started doing my research on surgeons, breast surgeons, and plastic surgeons. I did some research on what type of reconstruction I wanted, and I wanted to have my own tissue. I did not want to have implants. And so I was recommended to an excellent breast surgeon through the Force, which is Facing Our Risk Against Cancer and Powered, which is a group that I found online. And I went to my first meeting and I met some wonderful women there, and they highly recommended this breast surgeon. So I went to see him and I was very, very happy with him. And then I had just done some research about plastic surgeons myself, and had a consultation with the plastic surgeon, and he did not feel that I had enough tissue to do a tissue transplant of my own, and highly really told me my only option was really to have implant surgery. I had my surgery 3 months later after I was diagnosed, and had my exchange 3 or 4 months after that, and had my implants put in. My recovery was excellent. I felt great. I was back to work. You know, I had to be off for 6 weeks, but I felt very good. I hardly took any pain medication. It went very smoothly. And then for a few years, I didn't complete the reconstruction. I never had my nipples reconstructed or had tattoos done. I don't know, I just was like, they're not really mine, so it just didn't seem necessary. But my plastic surgeon kept saying, you know, you really should complete the process because, you know, you want them to be a complete breast. So one of the gals in my support group for Force had gone to see Vinnie Myers and had 3D nipple tattoos done in Maryland, and they were amazing. And so I decided to do that, and in April, a couple years ago, my husband and I flew down to Maryland, and I went to see Vinnie Myers, who's an incredible man, and he said that my surgery results looked really good, and he said, I'll be very honest with you, and he was, so that was good. And he did a great job. So I had a beautiful set of breasts. However, they were kind of painful. They were too large, and I really did not like them. And I went to the Force conference last summer, and I started talking to the New Orleans Reconstructive Center physicians because we had had a plastic surgeon who had come to our group and talked about having deep flap surgery. And I started thinking, I wonder if I could do something like that. So I talked to the surgeons at Force, and they said, absolutely, there's no reason why you can't have that done. And I went home very excited, and my husband was behind me 100%, like he's been all along. And so I started working with them, but unfortunately my insurance did not cover the surgery at their facility. And I really did not want to spend that kind of money. My husband said, go right ahead. If that's what you want, that's something you wanted, we'll make it work, but I just couldn't do it. So I started researching online, and I found a gal on Facebook who does a group for deep flap surgeries. And I started communicating with her and found out that she had gone to PRMA in San Antonio and highly recommended them. And what was nice about them, and the same thing with New Orleans, is that because it was a double, they have two surgeons that work on you at the same time. So your time underneath anesthesia is almost cut in half. And that really appealed to me. I did not want to risk my life being on this surgical table for 14 hours to have it done in Michigan, and there was very few surgeons here in Michigan that will do the surgery. So I went to San Antonio. I did a virtual consultation with PRMA, and I was a candidate. There were two things. He said, you're not going to be very big, and I said, that's okay. I'm fine with that. And so we flew out there. I had my surgery. I was in the hospital for 3 days. And then I had to stay in San Antonio at a hotel for 3 weeks after my surgery. And that was probably the hardest thing I ever had to do because I was very homesick. I didn't feel good. You know, you just want to be home. But everything went really well. And so that was phase 1. And I still need to return to have phase 2 done, but I haven't scheduled that yet. When I went to see Vinnie Myers, he really kind of planted a seed in my head about how a woman really needs to pursue what you really want in reconstruction. And a plastic surgeon should be able to give you that result. And it should be the result that you desire, not what's convenient for the plastic surgeon or for anyone else in your life. You need to do your homework and you need to really pursue. I think have such a fear at the time, and all you can think of is, I just want them off. I just don't want to have to worry about it. And you don't think down the road of, your outcome. I mean, for years, I always thought that I would develop cancer at an early age like my mother. So I didn't expect to be here at this age because I thought for sure I'll probably get cancer. And, my mom died at 52. And so, you're just so used to not really thinking of the future. But once you have this surgery and my results are so great and my risk is reduced to a tiny percentage, I really, I'm really glad that I pursued getting what I really, really wanted. The 3D nipple that Vinnie Myers does is, for me, when you have a double, he doesn't have to make it match anything. And a lot of women that come to see him have had a single mastectomy, so he has to make it match their own natural nipple. So I didn't have that. So he basically kind of looks at it and just kind of decides a skin tone color, shows you the color ink. And the reason I pursued having Vinnie do it versus the plastic surgeon's office is because a lot of plastic surgeons, they use a vegetable dye for their tattooing, and it does not last. It fades, and you have to have it redone. And I really didn't want to go through it more than once. So Vinnie uses actual tattooing ink, and they looked pretty amazing. They looked pretty real. I still need to have phase 2 involves fat grafting to make them more natural shape, to make them more even, more rounded looking. I have like some cave-ins, and they're not really that attractive. And I also have there's a skin flap from my abdomen that's kind of like an eye-shaped piece of skin that when you go back for phase 2, they remove that, or they cut that down so that it's like a circle. So then when you have your nipple tattoo done, it covers that up and you don't even see your scar. So I'm pretty active. I play senior softball. I travel around the country and playing tournaments, and I've been able to play. I don't have any restrictions. I didn't have anything that kept me from doing anything. My recovery was 6 weeks from my deep flap surgery, and I've gotten some of the feeling back in my abdomen area. Naturally, it's kind of numb for a while because they cut all the nerves and things like that, but I don't have any pain or any discomfort, or, it doesn't keep me from doing anything. I really strongly recommend, if you have a lot of cancer in your family and you are concerned about your hereditary risk of cancer, I strongly feel that everyone should go see a genetic counselor. They will go over every possibility. They discuss your medical options, your surgical options, your surveillance options. With being BRCA2, I'm at a slightly higher risk for pancreatic cancer, melanoma. So I have to be screened for those things. I also lost a brother to colon cancer at the age of 50 years old. He was actually diagnosed the year that I had my surgery. The year I was tested, I'm sorry. And so I went back to the genetic counselors, and I actually had a 17-panel further study to make sure that there wasn't some other genetic gene that was colon cancer, breast, ovarian cancer related, and I didn't, which is good. But if you have a lot of cancer in your family, I think you really need to talk to a genetic counselor.